Cervical cancer is one of the most preventable cancers, and with HPV vaccination and regular screening, early changes can be treated long before cancer starts. Cervical cancer begins when persistent infection with high-risk human papillomavirus, HPV, causes abnormal cell changes in the cervix that can progress from precancer (CIN) to invasive cancer over years. Screening finds these changes early, and outpatient treatments can remove or destroy abnormal areas before they turn cancerous. Early stages often have no symptoms, which is why routine screening is essential. Warning signs can include abnormal vaginal bleeding after sex, between periods, or after menopause, unusual watery or bloody discharge, or pelvic pain. Advanced disease may cause pain during sex, back-leg swelling, or trouble urinating. Any persistent change needs evaluation. Persistent high-risk HPV infection, especially type 16 and 18, not being screened regularly or missing follow-up for abnormal results. Smoking, immunosuppression, multiple partners or early sexual debut, and long-term use of hormonal contraception without regular screening. HPV vaccination for eligible preteens, teens, and young adults reduces the risk of cervical precancer and cancer. Most important, follow age-appropriate screening intervals and complete recommended follow-up if results are abnormal. Ages 21 to 29, cervical cytology (PAP) test at regular intervals. HPV testing may be added in some settings. Ages 30 to 65. One of three options: primary high-risk HPV testing every 5 years, HPV PAP co-testing every 5 years, or PAP alone every 3 years. Choose the method available and stick to the schedule. Over 65, many can stop screening if they've had adequate negative results and no history of significant precancer. Confirm with a clinician. After total hysterectomy for benign reasons, cervix removed, screening may stop unless there's a prior history of significant precancer confirmed individually. Abnormal results. Triage may include repeat testing, HPV genotyping, or colposcopy, a closer exam of the cervix, with biopsy. If cancer is suspected, biopsy confirms the diagnosis and type, typically squamous cell carcinoma or adenocarcinoma. Early localized disease. Surgery, conization, or hysterectomy depending on stage and fertility goals, with cure rates that are very high. Locally advanced. Chemoradiation is standard and often curative. Survivorship care includes pelvic floor and sexual health support, fertility counseling where relevant, and diligent follow-up. Prevention is powerful. HPV vaccination plus regular screening stops cancer before it starts. And subscribe for concise, evidence-based health videos every week. Like, share, and subscribe.